there are two ways to look at integrating motivational interviewing into one's work. And some people think that, it takes too much time, to practice this way rather than just the authoritarian telling people. That's much faster and expedient to do. So I'd like to discuss that from 2 points of view. I believe that regardless of what the physician is discussing, that using the motivational interviewing communication skills will not lengthen the session, but will perhaps deepen it or make it more compatible, make it more of a joining and a partnership. But on the other hand, there are a lot of things that need to be addressed in a visit for a physical issue or physical checkups. And there are what are called brief interventions in motivational interviewing, whereby one or perhaps two of the interventions that might take 5 minutes each are integrated into the session. One thing about brief interventions is that the physician would need to consider the readiness stage. It needs to match up with the client's readiness, whatever one of those are. There are ways in which a physician can go about all the needs and content that they have for their regular session using motivational interviewing communication skills, and then add perhaps 1 or 2 5-minute interactions that would address the change process or moving the person along the change process and evoking information that might be useful that way. One of those, they're called brief intervention strategies. One set of them is called 5 easy pieces. Here the provider might say something like, give me an example of a typical day of when you would decide not to take your medication. Okay, so now the client is on that side of things and telling, well, if I get up and I'm already feeling tired, and I don't have enough energy to do it, I have a whole list of things to do, and I know I'm going to get more tired if I take that medication, that would sort of start me off to say, well, maybe I'll take it later. Let me get things done first, and I might take it later. And the client would now begin to expand on what their day looks like. Then if I get around to nighttime, I might decide I want to have some wine with my dinner, and it's really not good to drink with it. So I might skip it then and say, well, maybe I'll take it before I go to bed, and then I'm usually so tired, I forget about it. I'll absolutely forget about it. Sometimes I'm going to take it, and I'll just completely forget that I had to take it. So now the doctor has a snapshot of what the issues are here. The tiredness, the drinking, interacting, and then just letting go of the need for it. And so that would be one typical day. Question that would give, within a session, the doctor a good example of how things look that they could begin to reflect on, follow up on, perhaps take one piece out. Let's look at the tiredness. Is there a way perhaps to adjust this dose that might change that, or a different medication, or so that they may begin to formulate a goal out of that. So they say the doctor only used that one. Okay. Another one of the 5 easy pieces is called examining pros and cons. And here's where we might ask the client, now, tell me what some of the good things are about taking medication. What, if anything, is beneficial for you? And the client might say, well, it does help the pain go away. I do feel, sometimes a lot better, than I would normally as far as that goes, and I could function better from that point of view. And then the physician might say, and what are some of the not so good things about it? And then the client, we might go back to some of the earlier reasons. Well, it makes me very tired. I can't enjoy having a drink when I want to because, I'm concerned about the mixing together. And sometimes I just forget. I just can't keep up with remembering this all the time. And it's like something that's always nagging me, that I have to remember to do this, and I'm out places and I have to think about doing this, and so I really don't like that. Okay, so now the pros and cons now provide 2 sides for the physician. One is that the client actually does recognize some benefits here, that it does help the pain, it does help the functioning from that point of view, but then there are also these negatives. And that gives the physician more information now to formulate a goal around this. Where can we go with this? Is it possible to change the dose, to change to a different medication, to help the client to find ways to remember when to take it, to find ways for the client to integrate occasional drinks without having to be so concerned, so that now we've formulated these goal areas, and the physician can proceed around these change goal areas. Okay, so that would be another one. That would be the second one. All right, the third one would be exploring concerns. Here, the physician simply, in the realm of everything else they're doing with this client, wants to find out, and is actually eliciting change talk, what concerns the client most about this? And may simply ask them, what concerns you most about this, about, having been diagnosed with this particular disorder or illness. And the client may begin to again give change talk and give some kind of a way to shape where we're going with this. So the client might say, well, I keep hearing about, all these long-term effects, that people get strokes and heart attacks, and, that concerns me somewhat, although I don't think I'm that bad. I may not be as bad as that, many other people that end up like that. So now the physician might reflect that and say something. So you are concerned, though, that some people do get heart attacks and strokes from not attending to their treatment plans, but you don't think that you're quite as bad as they are. But on the other hand, it does concern you, but it seems like you can't really be sure whether it could get that bad or not. Okay, so now we have a little bit of a picture of where the client is as far as what they care about. That they do know some of the long-term effects, that they do have some concern that this could happen to them, and we could begin to build on that. Here you can do the elicit, provide elicit again. Would you like some information that's very factual about how, this long-term effects can help, how risks in your health, can come about from not controlling this illness. And that would be just one little area that would be added into that session that would lend itself to looking at, where we're going from here. Okay, so that in the collaborative style of the plan, it's really important to be giving the client a voice and to letting them know that their voice matters. So the doctor might say something like, if we go ahead with this plan, I'm going to need your continual feedback to know how it's working. Are you willing for us to continue to discuss this and, to collaborate around this? So I know, your information is very important to improve the situation that we have right now. So that would be one way in which the doctor, might convey that. So that in the planning process, now that the client may be more invested in having given the information and having the doctor following their reasons for not being able to be adherent to whatever it is that they may be doing, and having that addressed specifically and becoming a partner and following through and trying to correct it or fix it is a very different process than one prescribing something to an individual where they don't have a voice, where it's like really going to be up to them to figure out now how to fit this in their lives and lie about it perhaps if they come back and not feel comfortable even to say that what that particular patient said in the beginning. That I don't take it, I want to have a drink and I don't take. This is where the engagement and the open questions and reflecting, where we talked much earlier about the trusting elements, allows a person to go. They're sitting in a safe place now. And I can say, I don't take it. And actually, in the 5 easy pieces, the question opened it up for me. What concerns me, my typical day of not taking the medication. I was actually asked about it so that I could bring this in as a normal conversation. The fourth one of the 5 easy pieces is what one might call information exchange. And as we talked about a bit earlier, the elicit, provide, elicit could certainly be used in giving information. But also, it is an absolute requirement, let's say in motivational interviewing, that whenever a practitioner gives information, advice, that they ask permission first. So rather than saying something like, this program would be really good for you. Why don't you take a look at it, go home, see what you think? Versus, would you like to know about a program that might be good for you? And hereby the client has the opportunity to say yes or no, so that if they say yes, they're inviting the information. The client could very well say no. Say, no, I've been to that program. I don't like it. I don't want to even look at the papers anymore. So if we think about if the physician hadn't asked about it, then they'd be giving all of this information to somebody who really doesn't want it, who's not going to go. If they've shaped out the client's side of things. All right, so that asking permission, then giving the information, and then always giving the client a chance to reject or accept that information. How do you think that might work for you? And the client would say, well, I've tried it once before, but at that time I really didn't want to change this. Maybe it'll work this time because I really want to change this now. But you're getting the feedback from the individual, and then that would be reflected. And that might be one step the client might take. So within the information exchange process, again, now you are within a 5-minute framework opening up an area to give the client some consideration about what they want to do about this, information about what might be useful or advice about it, and then a chance to consider it, how it might fit in for them. So that could be just done among everything else that's done in that meeting. Okay, so another and the fifth one of the 5 easy pieces is helping with decision making. Here, one might consider what is called the guiding approach, where the client is asked about what they may already know. It has a similarity and can differ in some ways from the elicit, provide, elicit, but it generally is the same kind of format where the client is asked about, the information, what they know about it. Somehow we've indicated that they do want to talk about that, and then the physician might guide them in some certain direction. One thing that has helped for other people is a particular group that they go to talk about this, that gives them a support network, etc. And then, again, the ability for the person to reject that. Another part of the decision making would be what we talked about a little bit earlier, and that is the ambivalence that the client has. So again, in the decision making process, the physician might reflect back what they're hearing, the two different sides. Sometimes the ambivalence is not presented by the client in a neat little package, but we hear it in these disparate places and we pull it together and say, what I've heard you saying today is that you really enjoy, the diet and the eating habits that you have right now. You would never change it. If you didn't have diabetes, this is the way you would eat for the rest of your life. Your family, your holidays evolve around it, your culture. And on the other hand, you do have some very serious concerns. You've seen some of your other relatives have some of the long-term effects of diabetes, and you really don't want to, leave your children early. You want to spend, good time with them and, have grandchildren and really be healthy and be able to do the things that you like to do. So these things might have been said in different ways. And so again, helping with decision making may be a way of presenting to the person, this is what you're dealing with here. These are the elements of your decision. These are the reasons not to change. These are the reasons to change. And these are what you're basing your decision around. So that there are different kinds of ways of guiding the client through decision making. But as in all of the other interventions, one needs to be eliciting from the client the information in order to have this process, but also including the expertise of the physician. I know this works for certain people. I've seen people change with that. you know, and what do you think about that? But always with permission and giving the person a chance to reject it.